dry cough, tiredness, body ache, body pain, sore throat, loss of taste, loss of smell, difficulty breathing or shortness of breath, chest pain, and loss of speech. Now, in the second wave, we are seeing many more symptoms in addition to these previous symptoms. They are loose motion, conjunctivitis, vomiting, fatigue, headache, dry mouth, skin rashes. If you find any of these symptoms in yourself or any of your loved ones or relatives, you should not hesitate to call the National Helpline 1075 or contact your nearest physician who is available either through telemedicine or through direct physical contact, because these symptoms can be of the COVID-19 and they need to be treated as soon as possible. Once you find these symptoms, how to get investigated? During the first wave, people majorly talked about three different things: the rapid antigen test or the RAT test, the RT-PCR test or the reverse transcriptase polymerase chain reaction, and finally chest X-ray or HRCT chest. Discussing all these things, in the previous wave, the RAT test or the rapid antigen test showed a high number of true positives and very few false negatives, which means it was a very effective test for the earlier strain of COVID. But in the current scenario, we cannot be very sure of what the RAT tells us, because if the RAT comes out to be negative and the patient is symptomatic, the patient is asked to go for an RT-PCR because the RAT is unable to detect some of the new variants. While in the previous COVID wave, RT-PCR was very effective modality for detection of COVID cases, as if a person who came out to be positive was mostly a true positive and a person who came out as negative was mostly a true negative. But now the scenario is not the same. Even RT-PCR is not so reliable agent. Many people have turned out to be RT-PCR negative while they are symptomatic and on HRCT chest are diagnosed to have COVID-19. Now, talking of HRCT chest was a modality which was rarely used in the previous wave. Only high-risk cases or patients who were not getting determined by the RT-PCR, and that was a very less fraction, went for HRCT chest or X-ray. While in this wave, most of the patients who come RT-PCR negative or RT-PCR positive, if they are symptomatic and have moderate degree of disease, are asked to go for an HRCT test by their physician. Recently, there was a debate in which one of the most prestigious doctors of our country had said that HRCT test should not be done regularly or should not be done for mild diseases, because one HRCT test amounts to around 300 chest X-rays. This statement instilled a lot of debate in the entire nation, and the medical fraternity was shook by this statement of this great doctor. But actually, what the conclusions came out later and what the radiologists believe was that one HRCT scan was equivalent to around 5 to 6 digital X-rays, which is not that bad if you are going to diagnose a moderate COVID disease. In addition to these investigations, something lies common between the first and the second wave, and these investigations are investigations like CBC, CRP, LDH, D-dimer, etc. etc. These are the inflammatory markers, and they only tell us the status of how bad or how increased the inflammation is in the body. And these markers helped us during the previous wave also, and they're continuing to help us in this current wave. So summarizing the video, we learned about the variants. We learned about the different factors causing increased mortality and morbidity in the young as well as in the adults. We learned about the new symptoms present in this wave. We learned how the investigative procedures have changed or have failed to provide a better result during this wave.